So welcome everybody who has joined. My name is Rachel. I'm an admin for Body Politic. Just a quick introduction of myself. I have been sick with long COVID since March 2020, and I joined Body Politic and started doing some work here just because I wanted to be able to help some more people and spread awareness for this cause. So I'm really happy that we're able to do this event today with Dr. Winkler. And to give a short introduction of Dr. Winkler here, she is a nurse psychotherapist who works with patients who are chronically ill. And she has graciously devoted some time to talk to our audience of mostly patients with COVID through Body Politic, and we're really happy to have her. So um, the format of our event today is going to be about, let's say, like 25, 30 minutes of an introduction where Dr. Winkler is going to talk about how her work is shaped by COVID and addressing the major questions that our audience has, and then we will bring it up to Q&A that so many people have entered into Slack, and yeah, we'll be open for some more questions, but there's a lot to get through, so we've got a lot on our agenda. And now I will give it over to Dr. Winkler to further her introduction.
Hi, everybody. Thank you for inviting me to Body Politic. And I guess I'll say just a little bit more about what my work has been like over the past 20 or so years. Because I have a background as a nurse, before I got my PhD in clinical psychology, it was a really easy and good segue for me to develop this specialty in doing psychotherapy with folks who have chronic illness. Also, I've lived with chronic illness myself, including a few autoimmune disorders since I was an early adult or a young adult. And so I have a lot of intimate experience with the issues of chronic illness and emotional and psychological life. Aside from being a therapist, I've worked as an educator for many years. I was a professor of community health, and I've trained community health workers to do work around health behavior change and support on the community level. I used to run a women's health promotion program and have done some writing on gender and sexuality. And I've been an activist for many years. And so I'm so excited to do some work with Body Politic. I reached out to them as soon as I heard of them because I was so admiring of the work that you all have been doing. So thank you for having me here. I'm going to kind of read through some of this. I'll try not to be looking all the time at my notes, but please forgive me if I do. I'm going to talk about some of the things that I've learned in my practice. Obviously, only recently have I been working with people with COVID and long COVID. I have a lot of experience with autoimmune disease like type 1 diabetes or rheumatoid arthritis and various serious pulmonary disorders like cystic fibrosis, a full range. I've run the gamut in all these years. But I just want to say that over the past year, living through a pandemic alongside my patients and my community, new dynamics, I would say, have come into focus during what's obviously been this time of extraordinary historical pain and isolation, which weighs particularly heavy on people with chronic illnesses and disabilities. What we've also seen, as I'm sure many of you know, medical trauma has become more widespread. and compounded by the ongoing trauma of white supremacy for Black and Brown communities and other communities of color. Um, I've taught about health disparities and structural racism for a long time. Um, and I think and hope that this pandemic has made it harder for people to look away from those issues. Anyway, I am honored to be sharing with you, and I'm really looking forward to learning from you through this relationship with body politic. I'm going to start with a quote to frame the conversation. Some of you have probably heard this before, as it's often centered in writing and conversation about illness. It's by Susan Sontag, who wrote a book called Illness as Metaphor. And it says, "Illness is the night side of life, a more onerous citizenship. Everyone who is born holds dual citizenship in the kingdom of the well and the kingdom of the sick. Although we all prefer to use the good passport, sooner or later, each of us is obliged, at least for a spell, to identify ourselves as citizens of that other place." So let me talk first a bit about what it's like in this other place where we live, and what it's like to live with a chronic condition, as many of you are learning. I guess I would start by saying the body, which for many people in many circumstances may be taken for granted, as more or less constant in our sense of going on being, may be fundamentally disrupted when the body is sick. And I love that term, going on being. It's actually from a psychoanalyst and pediatrician named Donald Winnicott. What does it mean to have your primary sources of going on being taken away with an illness diagnosis, especially one so new and mysterious as COVID? I would say one of the main things is that, familiar landmarks of life are gone, and sometimes they're even shattered. Another quote that I think really captures an important element of this experience is from Oliver Sacks, who says, "Any disease introduces a doubleness into life, and it with its own demands, needs, and limitations." The doubleness that Sacks notes, I think, really sheds light on the feeling of the chronically ill person, that the disease is sort of both me and not me at the same time. In part, that kind of split comes about because of all the new things that we have to do or abstain from since we've become ill. Medications, timing of activity and exertion, medical appointments, sleep, to name just a few things. Another psychoanalyst, Mary Joan Gerson, who's researched and written a lot about ulcerative colitis, wrote that the existential inequity of illness, that is, who is well and who is not, is disturbing to all of us. Illness is unique, unshared, and unfair. So, with a new diagnosis like long COVID, or really with many diagnoses of chronic illness, a person is forced to sort of slowly grasp the enormity of what is happening to them. The burden of illness, as I'm sure, again, many of you know, impacts all aspects of life: family, social life, job or career, school, finances, identity, to name just a handful. So much is being asked of you or of us. Unfortunately, I want to say that in the face of this, there's really all too often what I would call kind of a psychological poverty of medical care. Many, or maybe even most, of the patients that I see tell me that their doctors or specialists have basically never even asked them how they're feeling or coping emotionally. They're never asked what might be difficult or challenging to them about caring for themselves. They're never asked how they manage stress from the illness or other sources, or what their support network is like. They're never asked how motivated or confident they are that they can follow the doctor's recommendations. And providers often don't invite or acknowledge the expression of painful feelings. Because in many cases, they can't handle such an expression. They haven't been trained for it, some of them, and often because they feel overwhelmed themselves. And I think this may be particularly true during these times. So in my view, what's needed is psychologically oriented care, but it's seldom offered. I'm hopeful that we may be beginning to see some of this change with institutions trying to incorporate training in trauma-informed care, and more medical schools offering coursework in what's called narrative medicine, which is basically just learning to elicit and value patients' stories and to listen carefully, which of course we wish all doctors were doing all the time. So I'm going to share with you some of the psychological or emotional dynamics that I've come to know pretty deeply over the last 20 or so years. And some of these may feel familiar to you and be things you find yourself struggling with since you've become ill, and some may not apply. And you may have still others because we all have our own dynamics that are shaped by our histories and our circumstances, as well as the particularities of illness and symptoms. And I just want to acknowledge, I guess, that for some of you, long COVID is not the first or the only chronic illness you struggle with. Some of you have been in for the long haul with illnesses before becoming a COVID long hauler. So this is kind of a long list, but I do think it's important to name these things. So I hope you'll allow me to. Some of the things that I see as sort of key dynamics that people talk about in therapy with chronic illness are loneliness, helplessness and vulnerability, desolation, sometimes despair, guilt, fear of both the present and the future, sometimes shame, of course, loss, feeling really badly about yourself or your body, feelings of failure, struggles with dependence and independence, which can be particularly loaded with younger people or children who have long COVID or other chronic illnesses. Problems with finding ways to communicate what's happening to you, and sometimes even finding the words at all with fatigue and brain fog. Problems with what I call self-regulation, which is all the feelings that may erupt in unexpected moments, or just also the stress of regulating your symptoms and your body. Anger, even rage and destructiveness, which sometimes gets turned inward, and may also emotionally threaten relationships with loved ones. The sense that illness can't be recognized or held or included in our relationships. Problems with intimacy for young adults in particular who may be learning to have intimate relationships and explore sexuality. The challenge of how to deal with illness and sexuality can be a really huge one. Nihilism or hopelessness, what's the point of anything? And some people may have had significant experiences of danger or trauma in the past that are activated by the illness experience of long COVID and the medical trauma that so often accompanies it. We hold memories in the body. At least that's my view of things as a psychodynamically oriented psychotherapist. And so it's natural, I think, that illness or disequilibrium in the body would shift or stir up memory that's lived there, including traumatic memories. In addition, again, to the repeated trauma people may experience in the medical system, including the experience of not being believed or gaslighted. Grief is, of course, one of the main things that we work with in therapy. I want to, I guess, emphasize that the grief process doesn't move through fixed stages that you graduate from and get done with. really people can grieve in different ways for a lifetime, or they can get stirred up at particular moments. I know an older person who has a child who just suffered a miscarriage, and it stirred up for her not only grief for her daughter and loss of the grandchild she had hoped for, but also her own painful experiences with miscarriage, 50 years ago. Other things people sometimes feel is victimized and aware of just how the illness feels so unjust. One of the things I talk about a lot with patients is the sense of wavering between two seemingly contradictory poles, and I'm wondering how many of you may experience this. Am I making too big a deal of my illness, or am I really not making a big enough deal of it? And I think people can shift back and forth between those two poles, sometimes within an hour, and in many different manifestations in different relationships. We deal with the sense of family or friends failing us, which can be really destabilizing. And also identity is a big issue, I think. Being chronically ill kind of changes aspects of your identity. There's sort of on a big level, the sense of being permeated or controlled by illness even, but also, in smaller ways, you may be used to thinking of yourself as really smart and capable and mentally agile, with a great memory, and that's really been important to how you think of yourself. But now you struggle with brain fog and memory issues, which can be a huge loss and a huge blow. Or maybe you used to really pride yourself on being independent and really competent, and now you feel like a mess of neediness and you need help with everything and you can't do anything, and you have to rely on your family in ways you've not wanted to. So, the illness can really change how you feel about yourself. But I think, the good news is that, we generally really develop internal resources to cope and to mobilize, to survive and to live well. And I think these things, I just want to point out that in many ways, these are really admirable, and you need to give yourself credit for them, even though it seems like there's no choice. You didn't have a choice in the matter. But, these are sort of resources that we need to be able to show up for ourselves, even when we feel horrible and depleted. Chronic illness in general, and I think long COVID in particular, involves a remarkable amount of uncertainty, variability, unpredictability. So I would say that, management requires a massive amount of flexibility, adaptability, tolerance of uncertainty, and, these are really our superpowers. And, through everything, through being sick, you have to maintain organization, scheduling, focus to manage medications, food, rest, schoolwork, and other work and relationships. It's really hard. And I think a lot of that is cognitive work that operates largely out of view. Friends don't know, therapists even often don't know, professors or teachers don't know, coworkers don't know. And even you yourself may not realize sort of how many decisions, how much mental work is going on under the surface. I think other qualities that we develop to meet the demands of illness, you have to become vigilant and a curious observer and sort of even a theorist. Why did my symptoms get worse this week? I think it's also important to become really curious about the emotional states that you may experience rather than pushing them away. And obviously it's hard to find time and energy and literal space sometimes for noticing and thinking about all these, feelings, which can be really challenging. I think many people with illness are in an ongoing process of accepting being good enough. This also comes from the psychoanalyst and pediatrician that I mentioned earlier, Donald Winnicott, who talks about good enough mothering, that you're not supposed to be perfect. It's not even, in his case, good for the child to be, perfect if there was such a thing. And we're not always going to be, productive or excellent, and that's okay. And sometimes the sort of coming up against illness makes you realize that in a way that you never did in your life. Resilience, patience, the ability to slow down, frustration tolerance, persistence, compassion, including for ourselves. Listening, we get to be better listeners, including to our own bodies. We may sort of learn new things about our capacity to self-soothe, and our capacity to recognize and acknowledge different parts of ourselves, or different ways of being in the world. These are sometimes called self-states by psychodynamically or psychoanalytically inclined therapists. And they often sort of operate out of awareness, but I think sometimes when you're sick, they come more into awareness because you're living through all these contrasts. Forgiveness is another big dynamic that I think a lot of people work on, forgiving ourselves, and also forgiving other people who may not get it right, or may even tend not to get it right. And I think, we wind up needing to really forgive ourselves and allow ourselves our need for rest, because we need lots of rest. I think, what I find hopeful is that many of my patients, and perhaps many of you, have developed sort of self-care practices that sustain us. Things like mindfulness or guided imagery, and that can sometimes feel like a privilege. What I used to tell my students, many of whom lived in very overcrowded homes and were adults with children who were constantly nagging them, and obviously that's really the case now with kids home from school and studying remotely. That may mean 5 minutes alone time in the bathroom of a crowded apartment that you use for doing a meditation, for example. And I'll mention some resources later in terms of getting audio of, little 5 minute, 10 minute, 20 minute clips that you can listen to help with that. I think I also want to point out that it can be really hard when you feel depleted to think about meditating or, being mindful or whatever. But I would say that it can really help settle you so that the rest you get is of better quality. So it really can be worth trying that. Another thing that I think we all have to really develop as people with chronic illnesses is tremendous communication skills for dealing with providers and for dealing with clinic and hospital staff, for being able to belong in a family and with friends, where we have to sort of put words to feelings, including bodily sensations, that others really may not understand, so that some of that can be shared and experience communicated, and so we don't feel so alone with it. These are parts of I guess there are aspects of the fundamental process of psychotherapy, finding the words to say it, which is actually the title of a novel by French writer named Marie Cardinal. It can be finding the words to say it, of course, can be also hampered when you're too fatigued to even talk, or when you feel suddenly involved in or enveloped in thick, brain fog. But I think it's important. I think there's something about language and the capacity to describe in words physical experiences that aren't shared, even though, there's an inherent difficulty of describing bodily experience that may be unique to your illness. And that's leaving aside the issues of not being believed, even when you try to put it in words. And I'll hope to talk about that later. So what do chronically ill people, including people with long COVID, need? So I would say the number one thing is to be believed by family, by friends, by partners, by coworkers and healthcare providers. So if any of you have friends or family listening with you, I think that's really a fundamental shift that has to happen, including sort of in the culture. Obviously, I hope we need to have access to affordable and sensitive, culturally responsive healthcare, and providers who recognize, acknowledge, and address the emotional impact of living with chronic illness and are able to provide trauma-informed care. Trauma-informed care is not just how like an individual treats you, provider treats you, but it's sort of how the entire healthcare institution, the culture of healthcare operates to make patients feel safe. And it involves, there may be some of you who don't know, the core principles of safety, of trustworthiness and transparency, empowerment, peer support, and really humility and responsiveness and collaboration, which kind of involves in a lot of ways breaking down some of the power dynamics that have historically existed in our healthcare system. We need to be treated not with pity, but with compassion and respect and consideration, and to be valued for who we are and what we know, especially about our own bodies. And we need to be asked about what we know and what we need. And I think that's something really important that friends can learn how to do and enter into those kinds of conversations. We need support and sometimes help from our families and our communities. And I think this can sometimes be complicated because, when you're ill, you sort of more naturally depend on the help and care of family members. And so that also makes you particularly vulnerable to the interpersonal attitudes and even the sort of projections of significant others. And that's a lot to grapple with. I think, number 5 is we often, or maybe even always, need a compassionate psychotherapist to help accompany us through this maze of feelings and memories that may surface or be stirred up, including past losses and traumas. Although, I want to acknowledge that it's often hard to make time for therapy or have the energy for therapy or to even get access to a therapist who has training in medical illness. There's some resources on my website, and I'm going to be updating that in the next couple of weeks. There are low-cost training institutes and graduate programs where people can get low-cost therapy. Unfortunately, many of these programs include pretty much no training in working with chronic illness, which can be really hard when you're really suffering. You don't want to have to sort of teach, long COVID 101 to your provider. But it may be part of getting the care you need. I'm going to put a plug in right now for this very wonderful book that I recommend people take a look at. It's called What Doesn't Kill You: A Life with Chronic Illness, Lessons from a Body in Revolt by Tessa Miller. I was interviewed for this book along with a number of other therapists around the country. Tessa is a writer who has Crohn's disease, and she writes about her experience, but she's writing a lot about the need for psychological support and psychotherapy. And she's got a couple of great things in her appendix in terms of how to find a therapist to work with. I think another thing that I want to say that we need is recognition that our illnesses have changed us in some ways, but they have not made us less than who we were before. They may make us different, and they may sometimes make us more than, because of all those qualities that we have to develop to cope and survive and live well. And the other thing is that we need advocacy. And, we often have to do that ourselves collectively. That's why I'm so excited to be here with Body Politic, because it's such an important, we both need it because we need to change systems, but it's also a way of feeling effective in the world and like you have a community, which is so important. I think it is, though, also important to acknowledge that there are allies in public health, for example, who are, also advocating for the needs of chronically ill and disabled people and fighting against health disparities and fighting for access. And our advocacy needs to address the enormous structural disparities that exist in resources, economics, education, healthcare system, for example, based on racism, sexism, ableism, heterosexual and cisgender normativity. All that is real, and I would guess that some of those things have emerged even as issues within body politic. And then lastly, I just want to say, and I'll close here, I'm sorry I've gone on for a long time, we need joy, and we need to be able to, take the time to create joy, to recognize it in small things, which may be all we can do when we're feeling really sick. And I think sometimes our support networks, our families, can help us create some of that joy. So I'll leave it there.
Wow, that was amazing. Thank you, Dr. Winkler. And I wish we had more time because I was holding my tongue, trying not to interject with my own anecdotes for everything I was saying. But I definitely agree with you about needing joy. I think I just mentioned to somebody else the other day that humor is acceptance, and if you can laugh with me about something that I'm going through, then we're connecting. So so then with that, let's head over to the Q&A.
Can I just say a couple things about the Q&A?
Yeah.
I'm going to do my best to answer as many of these questions as I can. I'm not as accustomed to being in this format where I don't get to see you. I don't know any context. So I will do the best that I can. I'm not going to be able to give any, specific, obviously, medical advice or medication advice. I can say some general things, but and I think it probably makes most sense to, as much as possible, ask questions and respond to them in a more general kind of way. Everybody may, people have their own very particular struggles and issues, but I think in this kind of format, it's probably makes more sense to sort of generalize as much as I can. The other thing I just do want to point out, I mentioned trauma a bunch of times while I was talking. I'm speaking sort of generally again about trauma, not necessarily about the specific diagnosis of PTSD. That is a specific diagnosis, and plenty of people experience trauma and traumatic stress without necessarily having all of the qualifiers for PTSD, and the D stands for a disorder, or complex PTSD, which means that it's basically ongoing. So I'm going to, sort of focus more on if people have questions about trauma, more general characteristics of trauma.
That's a great call out. Yeah, so we'll keep in mind, because I know you might have touched over some of these questions as well, and we want to get to everything broadly. So, yeah, let's start with question number one. Do you have any advice on how to handle emotional distress when you are particularly fatigued and drained?
That's a big one and can be, really hard. I do think that working with guided imagery and meditation can be very helpful in calming our physical responses to, that often arise or become exacerbated when we're feeling really, emotionally intense.
Yeah.
Again, so that's one thing. And that's, I think, important for both maintaining yourself physically and medically, and being able to deal with the emotions. I think taking the stance of being sort of a curious observer of waves of emotion that you may experience, sometimes even journaling if you have the energy to do that, can be helpful in getting to know yourself and getting to know what triggers you. I think sometimes we do have to, when we're feeling so depleted, put certain things maybe aside or out of view for a little while. For example, if you're having an interpersonal conflict with someone that evokes a lot of emotion, you really just may be too depleted and you have to give yourself permission to come back to it later.
Definitely. Okay, that's
I'm
great.
sorry, I'm going to give sort of relatively brief answers, I hope, because I know there's a lot of questions, I was told.
Yeah, totally
And
understand.
hopefully we can, find ways to continue this conversation later, or Body Politic, can bring some answers to these things or additional resources to the
Yeah.
community.
Yeah, exactly. Um, okay, so question two. How do I relate or be related now to family and friends who haven't been through this? They don't understand or they're pulling away.
That's a very important question. And the experience of people pulling away is very, unfortunately, very common and painful. One of the things that I talked about in the interview for that book, What Doesn't Kill You, is what friends can do and how friends really need to listen and sort of decenter themselves to, and center the person who's ill more, which oftentimes doesn't happen. So, giving the book to, or encouraging friends and family to read some of this may be helpful. I think another thing that can sometimes be useful is to kind of make almost like a wellness plan for yourself, and to think about what are the things you need, and who are the people in your life that might be able to help you with some of those things, and how would you talk to them about it. The attitude that I think friends and family, obviously, we wish they would have, and many do, is that they need to learn from you, right? They need to try to learn some on their own, because again, your job is not to be teaching long COVID 101 to every single person on repeat. But, people need to ask, like, what is it like for you? Not like, how are you feeling? Or, are you better yet? But what's it like? Like, what does it feel like? What are you going through? One of the anecdote or the story about how the woman whose name I'm forgetting now sort of came up with the idea of spoons was that exactly that a friend of hers sort of unexpectedly, sitting over tea or coffee or whatever, asked her, what is it like? And so, that woman, who I believe had lupus, very creatively, right, using the spoons on the table, tried to explain what it feels like. And I had that experience once too, and it's very powerful. One of the conditions that I live with and manage is type 1 diabetes, and I was once giving a workshop, a training workshop, an all-day thing for community health workers, and I had a low blood sugar. So I had to leave the table for a few minutes and, go get some sugar in my system and, kind of called a break. And when I came back, one of the participants, approached me and said, what does it feel like? And, not in an intrusive way, but really in a concerned and curious way. And it gave me pause, because I realized that very few people in my whole life have asked me that. So it was it was actually kind of profound to be asked that, and to, to find the words to describe it to someone who's never had that experience. Rachel, have I answered that question, or did I go off track? Should I say more?
No, I think that's great. I completely agree. I've had some conditions before this as well, and when people say, "Oh, I'm sorry, I don't mean to like intrude," or it's too much, if it's too much to ask, and I'm like, no, like you asking me about my experience, like you're trying to understand, like I'm okay with that. Although I mean, boundaries are great, but if you're okay explaining it, like that's way better than somebody just ignoring everything.
Right. Well, and what we don't want, right, is also all those people saying, "Oh, have you tried chamomile tea?" or
No, no.
whatever, which gets, maybe you should stop eating gluten, or whatever things people are trying to be helpful. But we don't have a lot of experience, I think, in this culture, broadly understood, in Western culture, whatever, really talking about and accepting illness. So I think it can be very hard for people, and we as patients worry that we're not the same as we used to be, and will they accept that I have to cancel plans and I'm so tired, and all that kind of stuff.
Yeah, no, I understand that. Okay, so the next question, and I think you actually might have gone over this, so we can just touch briefly, but how can we provide, or how can we guide providers to deliver trauma-informed care?
I think that's a big burden for patients to have to guide providers. I think some of the point is that when we're feeling traumatized within the medical system and possibly having past traumas stirred up, it's pretty hard to to then educate your provider that, oh, I'm sorry, I'm crying because, whatever. And, again, I think there are institutional changes happening. There are websites that are focused on implementation of trauma-informed care sort of across an organization, across an institution. I recently talked to an old friend who had been involved in a project working with early childhood educators about, training them about trauma-informed care. What does that mean in all these different settings? So again, I think that's perhaps a bigger advocacy question. And I don't know if Body Politic has taken that on or been involved in that. Trauma-informed care can involve, sometimes there are some agencies or clinics or doctor's offices may use, some of these, there are like checklists of adverse childhood experiences, things that you may have encountered. Those aren't necessarily something that, you can provide or come up with. I think if you're feeling well enough and sort of hardy enough to, and trusting enough to talk to a doctor or a nurse or nurse practitioner, whatever, about how you've experienced care, either from them or from others in their institution, that can be important to share to start raising awareness.
Yeah. I felt well enough one day to call my doctor's office and say, this is how I was treated, and I think somebody after me would appreciate if you addressed it differently. But I can't do that for every doctor,
Yeah.
Yeah.
Absolutely.
Okay. So the next question, any advice about how to handle family members who have not yet accepted your change of health status and how to manage emotions about this? Yeah.
I think, we've sort of talked about that. Communicating with family members about your needs when you're also possibly feeling hurt by the fact that they're not understanding or they're not believing or they don't get it can be hard. I think perhaps it's, important to sort of recognize and acknowledge when they're trying to make efforts, even if they're small or sort of misplaced. I think, sometimes finding things that you feel kind of sort of explain the experience of people dealing with long COVID can be something, that you can give to someone to read. I heard not that long ago about someone was telling me that, who'd had their chronic illness for many years, that their brother called them one day and said, oh, do you know? And that, and then sort of told them something super basic about the illness, again, that they've had for whatever, I don't know, 20 years or something like that. And, what was so striking, of course, is that this family member thought that was news because they had just read an article about it, and had not in 20 years spent the time to learn more or to ask more. And yet, it was really sort of a shift that that this family member had, had shown this new interest or concern. So I think it was hard to acknowledge and praise or recognize it, but giving sort of positive reinforcement for that can sometimes be important.
Yeah, that's great.
Again, there are sort of tips in the book, What Doesn't Kill You, and I'm sure there are some other really good articles and books. Some of them I have on my website, and some I hope to post there soon.
Awesome. Thanks for those resources. Um, okay, so the next question is, how can long haulers treat PTSD, or we can refer to that as general trauma right now, from having COVID-19 if it isn't post yet, since we're still experiencing complications and post-viral syndrome?
I think, what's, as I mentioned before, what's sometimes called complex PTSD, CPTSD, or chronic PTSD is common in a lot of situations. I mean, think about war zones where every day involves more and more trauma. These are things that people who work with trauma and treat trauma have been thinking about for a long time. I used to actually be a trauma researcher many years ago. And I was involved in a project researching ongoing chronic trauma among women who were involved in the sex for drugs exchange with crack during the crack cocaine epidemic. And it was the first time I actually started thinking about this issue of chronic trauma, and also trauma that involves being marginalized and having what may be considered a sort of degraded identity, as many people with disabilities and all sorts of other marginalized people experience. I think finding a really good therapist. One way to do that, by the way, is by looking on Psychology Today and putting in the search term chronic illness or trauma, and you may be able to turn up some names who can then, even if they aren't in your insurance network, or you can't afford to see them, or they don't have openings, they may be willing and able to guide you to some resources in your area. I think so I guess I would say that that's one of the most important things in dealing with sort of the ongoing trauma of encounters with the medical system, with caring for yourself, with new symptoms that may emerge that you then have to deal with, but really can set you back emotionally. So I don't know if that fully enough answers the question, but yeah.
It's a beast of a question. So I think you did a really good job at providing the most information in such a short time. I know that we have a few minutes left, so I want to ask. I guess I'll do one more question, and then there was one that was highly upvoted, so we'll do that question after. So for this one, would you please offer some essential guidance for how parents can help our children manage this experience? An example, fluctuating symptoms, unknown recovery time, expectations for the future. And they specified younger kids and teenagers.
This is an incredibly important question. And I say that partly from this perspective of someone who has worked with adults who talk about their experience of being parented when they were younger and ill. And I think it's very complex for parents because, of course, as parents, we want to you know, reassure our kids that, you know, they can do anything, right? The world is their oyster. They're no different just because they're sick. But I think the fact is that kids know they are different. Um, and so if we don't give them room and ways to talk about that or express that, they can wind up feeling like I'm not supposed to be sick. I'm supposed to just do everything I was doing before just the way I was, and that's what, you know, my mother or father or caregivers think. And you know, that dilemma of am I making too big a deal out of it, can, you know, can start really young. I've known parents, you know, who've basically taken the like, let's be, you know, the cheerleader role and, you know, stiff upper lip, or I guess that's not necessarily something you would think of with kids, but, you know, get off the pity pot. And I think there's probably less of that going on now because I think the pandemic has been such a shock to everyone's system and so profound,
Yeah.
that my sense is that that more parents are aware of just even the question of how do I guide my child through this. I think it's important, obviously, to sort of express and reassure and emphasize that they are the same beloved person, and that, you know, you're going to be there for them and to hear them and to ask them questions and give them space or give them other kinds of, you know, whether it's art supplies or, you know, other ways that some children, you know, prefer to express themselves. I think it also can be, you know, really, really important to sort of acknowledge the emotional and psychological impact of what they're going through by taking them to see a therapist, a child therapist, where they can, for example, do play therapy. You know, lots of therapists who work with children have, you know, little toy hospitals and doctors' offices and things so that if kids don't have the words or the capacity yet, depending on the age, to express what they're going through, they can sort of show it to somebody without worrying that it's going to hurt you, that you're going to be upset with them or disappointed in them. So I guess that's one important thing. The other thing I think that's really, really important is that this is unbelievably stressful on parents to have your child ill, and to have, you know, so much uncertainty, which is obviously a big characteristic of long COVID, but it's true of many illnesses, where we don't know what's going to happen, and we don't know how it's going to unfold. And that's so painful, as a parent dealing with that. So I actually also really encourage parents, if they're not already in therapy, to at least get a consultation with someone who can support you through this, you know, on this difficult path. You know, kids are um, unpredictable enough. And, you know, if they're teenagers, there's all sorts of loaded issues about, you know, again, dependence and independence. And even for younger children who are, you know, may have been developmentally really starting to experience their own independence and then become sick and have to rely on you so much, and have, you know, even just with the pandemic generally have, you know, our worlds have shrunk so much. So I think it's a big challenge, and I'm glad you asked. But I think you know, I don't have time to go into it more deeply than that. But you know, I think sometimes family therapy can also be helpful, not because there's, you know, a problem, but to find ways to communicate about something that's so hard in the center of a family.
Yeah. No. Yeah, I agree. Um, And just that last question that I told you about, um, how can we find and maintain a balance between hope, optimism, working towards recovery with the need to accept and be present with what is? Um, the person says, I don't want to give up on the belief that I may still fully recover, nor do I want to give up on the life I have right now by resisting or holding out for something better.
Um,
It's loaded.
there's so many elements in that question, and it's kind of maybe one of the central um, sort of existential questions almost um, of living with a chronic illness. It's particularly relevant to long COVID because we know so little about it.
Mhm.
Um, um, I just I'm having the thought of something else that I'm going to relay to you that may not seem so directly related, but there are other illnesses that people that I've worked with other illnesses who 25 years into their illness, there's been a breakthrough medically in terms of medication. And I was approached recently by someone who's doing some graduate work on this question of how do people deal with the fact that they may have lived for 20, 30 years with the sense that there is no hope, and suddenly there's hope, and they start taking this medication and they don't have symptoms anymore, and their life is radically different, and their sense of future and purpose and everything else is radically altered. So I guess I'm raising that just because it's something that's been on my mind, and I think is sort of a parallel
Yeah.
issue, that we don't know, not just with COVID, but with other illnesses as well. And finding that place of balance is very tricky. Um,
Mhm.
Being able to be present, as you say, as whoever wrote the question or voted for the question, with what is now, and being able to adapt and be flexible and all those things that I enumerated at the beginning, but while still having hope, is a real challenge. I think that the thing that I ended on, the idea of finding joy, I think bits of joy help us stay hopeful,
Yeah.
and in a way that's not unrealistic, um, but just connects us um, to sort of our power and goodness in the world. Um, that's a very sort of limited response to what's, I think, a really expansive question
Yeah.
that all of us face who live with illness. But again, particularly for people who are now struggling, as you guys all are, with something that there's so little information and experience about. So
Yeah. No, I mean, I I really appreciate you digging into these very loaded questions. And I think your point about finding joy in the little ways that we can is, I think it's a great message and a great way to end this Q&A because I know that we've gone over, and there's just been so many questions, and I'm so happy we could touch on at least some of them.
yeah, and as you know, Rachel, I'm available and interested, and
Yeah.
able to to talk about whether there's any ways that we can follow up, either by putting some things into the chat, or coming up with resources for Body Politic to post, or even doing some kind of perhaps follow up, that's more specific, or in the future. So
Yeah, that sounds so great, and so glad we could cultivate this relationship. So I just wanted to say a big thank you to everybody who's watching, and to everyone who submit these questions. They were so thought provoking, and I'm really happy that I could be here to witness everything. So
thank you very much for sharing this space with me.
yeah, and especially a big thanks to you as well for being so generous with your time.
Sure.
So with that, I will stop the live stream, and everyone have a good Saturday afternoon, morning, evening, whatever it is your time.
Rest.